Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, April 20th, 2021. So the biggest development this week is, of course, that all adults in the US are eligible for vaccination now. There are no more categories by age, by health status, by job role. So anyone who wants a vaccine can sign up for one now. So vaccination should be pretty busy for the next couple of weeks. But this is your chance for everyone who's been patiently waiting for their turn. Also, this Friday, the FDA is going to make a decision about the Johnson & Johnson vaccine. Now, it's not very likely that they're going to just cancel use altogether, but there may be specific groups that may be recommended to have it or not. It's likely that older adults and possibly men as well, because may be recommended to be the ones to get the vaccine, the Johnson & Johnson vaccine, as there have been more blood clot reports in women and younger people. So we remain to see that and how that's going to affect the rate of vaccination. Just want to, of course, segue from that into looking at how the actual vaccination rate is going. So 264 million vaccines have gone out to the states. That's just under 6 million have reached Massachusetts, meaning the total is now 211 vaccinations have been given to United States residents. 5.2 million have been given within the Commonwealth. So that means a total of 130 million Americans have received at least one dose. That puts us up to over half of all American adults have gotten at least one vaccine. Here in Massachusetts, over 60% of our population has received a dose. That's 3.3 million people. In terms of total fully vaccinated people, that's 33% of American adults and 37% of Massachusetts adults. So things are getting there steadily, and we'll see how universal vaccinations will change the rate at which things are going out. Looking at how the state is vaccinated here, this is the percent of individuals in any given county that has received at least one dose. Now, this doesn't actually say much about the actual hesitancy or willingness in any given county. Obviously, the different counties have different demographic makeups. So some counties have larger portions of seniors, so they may have been giving more vaccines earlier. Similarly, different counties are getting different distributions, so they may just have been able to fill more clinics, and also it may have a lot to do as well with the availability of medical staff in any given county. An area like around Boston, where there's a lot of hospitals, a lot of doctors and nurses who may have some time to go out and participate in clinics, maybe doing more, whereas more rural counties may have less staff available for that. And looking at the rate of vaccination here, it has slightly slowed down, actually. This may be tied in with the pause on the Johnson & Johnson. That's pushing a couple of things back a couple of days for our projections for when we would reach every adult would have been able to get a vaccine if they want one. So that has gone back about 12 days there. Hopefully that'll pick back up again soon. I do have a theory, though, that with open enrollment for everyone, that's actually going to slow down the pace of vaccination as it takes away the sort of artificial scarcity we had before, but that remains to be seen. One final thought to take you into your week. This is a picture at the Wellington International Airport in New Zealand. New Zealand and Australia recently opened up a travel bubble between the two countries, allowing for free travel without quarantine. And so this is just a picture of all the people waiting. There's something like 500,000 New Zealanders live in Australia. It's like 60,000 Australians live in New Zealand. So there's a lot of families that were reunited for the first time in over a year, just this past couple of days. That's just kind of a nice thing to think about there. And for our sources, of course, we use CDC, mass.gov, and the New York Times. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.